Hello, everybody. This is Gary. Today is April 26th. It is 3:20 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Um, I had a COVID-19 test done yesterday, and it came back positive, so I have to quarantine for the next few days, and I had to cancel my knee surgery and reschedule it. My knee surgery on a torn meniscus was planned for this Friday, but because the COVID test came back positive, we rescheduled the surgery to May 13th and another COVID test on May 9th before the surgery. I am fully vaccinated. I had the first two Pfizer shots and then the booster shot, but apparently that wasn't enough to prevent me from catching COVID, according to the test that I had yesterday. So I had to reschedule everything. I was kind of angry, not at anyone in particular, just over the situation. I wanted to get the surgery and over and done with. My knee hurts like hell. I have a torn meniscus. I have loose cartilage in my knee. I twisted my knee really badly, and it really does need the surgery. And this just means I'm going to have to go through more physical pain because the surgery was delayed and rescheduled. So my anxiety levels are very high. My anger levels are very high. I'm not suicidal. I am very depressed. I just hope that I don't get sick, but I doubt that I will. Even if I did, it will probably be a mild set of symptoms. Right now, I'm not having any symptoms at all. When I checked my test results this morning, it was a complete surprise to me. I don't feel sick at all in any way. So I guess that's a good thing. As far as my schizophrenic symptoms are concerned, they're somewhat aggravated by all this. I'm sick and tired of not being able to get the surgery done and over with. My knee was twisted like 4 or 5 months ago, and I've been in pain for a long time. And it took a long time just to find out what the hell was wrong with my knee in the first place. And this just delays the pain for another 2 weeks. Makes it hurt. I have to walk on this leg, on this right knee. I have to do my food shopping. I have to clean my apartment. I have to do work. I have to exercise on this, walking around on this knee. And it's very painful and it's very uncomfortable. So I'm angry that I can't get the surgery done. At least not until May 13th. I had arranged everything for the surgery for this Friday, bought supplies, was ready to spend the next 2 or 3 days on crutches. Right after surgery, the surgery is going to be done outpatient, not in the hospital. But now I have to start all over again and start with a new plan for surgery. My auditory hallucinations are pretty much at a minimum. My paranoia levels are pretty much at a minimum. I'm just really pissed off and angry about having tested positive for COVID. So I guess I'm going to be isolated for at least 5 days. I think that's what they're asking me to do. So I have another COVID test on the 9th and surgery on the 13th of May. I had to cancel my appointment with my therapist that I had tomorrow because of COVID restrictions. I rescheduled that to May 10th, a couple of days before surgery. I'm seeing my psychiatrist on May 5th. I was supposed to see my psychiatrist last week, but he canceled it because he was sick. And so now I'm seeing my psychiatrist on the 5th, May 5th. I'm seeing my therapist on May 10th. I'm having another COVID test on May 9th. And if everything goes well, I'll have surgery on May 13th, outpatient. So I have to start all over again, rearrange transportation for the new COVID test, rearrange transportation for the surgery. It's all a royal pain in the ass. It just makes my psychiatric symptoms more difficult, makes my anxiety more difficult, makes my concentration poor. It's hard to focus on getting anything done when this shit keeps happening. I've already had 2 surgeries this year and I don't want to have another one, but I've got to do it because a torn meniscus will probably just get worse if I don't have surgery, and that's why I wanted to get it done and over with. There's nothing pleasant about surgery. It's not something that I was looking forward to, but it is something that's necessary to correct the physical pain that I'm experiencing in my right knee. So I'm still in touch with my therapist. I'm still in touch with my psychiatrist. Still, of course, taking my medications. And just doing the best I can to stick to my daily schedule, which includes making videos like this one. I primarily put my videos on YouTube, but I've also started putting them on rumble.com, minds.com, and BitChute. Same video, just different places where I'm posting it. But that's all for now.